Okay. Thank you for joining me today. First off, I want you to introduce yourself. Your name's optional. Tell me your age, what county you live in, and your mental health diagnosis.
Hey, I'm Izzy, 27 from Suffolk County, Central Islip, and I have chronic depression with PTSD, anxiety disorder, and bipolar schizoaffective.
Thank you. So first thing I want you to tell me about is a little bit about your mental health journey and just kind of tell me your everyday experiences with mental health, like what are some of the things that you deal with throughout, even before the pandemic or after the pandemic, doesn't matter. Just tell me a little bit more about your journey.
Well, I started this journey, seems like 2015. I actually just found out today. Started out, a good place and undiagnosed. Went through a lot of different hospitals and different doctors, different psychiatrists, different therapists. And I've spent the last good bit of time just working on myself and fixing the issues that I'm now learning I have. Living with PTSD or anxiety, depression, it can be hard, but there's good days and bad days. And I have just different things that I use to help me out with that. With COVID especially, it's been very difficult. I had a therapist for a while, and unfortunately, due to COVID, it was just not the greatest circumstances to be traveling and stuff like that. So I've been working for about the last 6 months to find a new psychiatrist, and getting back on track with that. Just working every day, a little bit better each day.
Thank you. I want to talk a little bit about the psychiatrist part because I know that we've been working together. And tell me some of the barriers and obstacles that you have discovered when it comes to finding a psychiatrist, especially in the last 6 months. Trying to find somebody. So can you tell me a little bit more about the barriers that you've been facing with that?
It's been very difficult. Being as a person who is disabled, I have Medicaid. So as far as psychiatrists and stuff go, especially here, it seems to be a little bit difficult to find anybody that accepts Medicaid, whether it be straight or with a managed care plan. So, I've spent the last 6 months making phone calls and perusing the internet to try and find anybody. And it seems with coronavirus, everybody's looking to speak to somebody, and everybody needs a little somebody to listen. So between, the limited resources for people on Medicaid and stuff like that, and the limited amount of doctors that do accept that, it's been very difficult. But I have a good group behind me that really are doing the absolute best they can, and I see it. And it's the
it is. I get it.
It's been great.
Yeah. Okay. So next question is, in what ways had the COVID-19 pandemic changed or impacted your day-to-day life? It had been more difficult to manage your struggle, more difficult to manage your mental health than it is prior to the pandemic?
I would absolutely say it's been way more difficult to manage, I'd say anybody's mental health, given the circumstances, between being locked up inside, quarantining for
Right.
the first, 5 months or whatever. And other people just losing jobs and watching other people around me, struggle and get through all this. It's been very humbling. But at the same time, I think for myself, it's been kind of nice. It sounds weird, but wearing a face mask and not having to show your entire face. And I think it's been nice in that regard that, you can feel a little bit more comfortable, in a strange way with that. And, I think it's been nice. Just the way the stores have been managing it, especially too, the limited amount of people in a store. So going to stores and stuff like that, especially during the pandemic, I just, it was nicer for me because I'm a person that struggles with anxiety. So a lot of people in a store makes it a little bit difficult, and them limiting the amount of people in kind of made it a little bit easier in that regard. But it's been very interesting.
Yeah, definitely. Have you found anything Okay, good question. What kind of obstacles or challenges have you encountered seeking help? I know that you discussed a little bit previously, but in terms of having Medicaid, but have you noticed any kind of stigmatizing behavior towards you when you're seeking mental health, especially like somebody who had bipolar, or factor? Do you encounter any of those things?
Um, it really depends upon really who I surround myself with. I've, over the last year definitely been stigmatized. People assume because I have a mental illness and I'm not on medication, I can't control myself or I can't be a good person. But, the people around me over the last year especially have learned that, I've changed as a person, and that I think I've come out better through all of this.
Really? Good.
Yeah, between friends that maybe weren't really that great friends that want to stigmatize you based on what you've done in the past or what your mental illness might have driven you to do in the past.
Right.
It's hard.
Definitely, definitely. I think I really, resonate with a lot of people, not even just people with mental health, but just in general. Like you really find out who's in your corner during the pandemic. And so I think that's definitely, a good point to bring upon.
Absolutely. I've been blessed this far to have truly some of the greatest people behind me helping me this entire way.
Good. Okay. Okay, what kind of interaction did you experience with your mental health services the past year? I know that you mentioned that you've been without a psychiatry for that month. You haven't been on medication as well. What other ways had the mental health or your mental health specifically interrupted your services this year, especially for the pandemic?
Um, Really, I couldn't really say how, but um, I mean, just like I said, the psychiatrist has been very difficult, find a doctor and stuff like that. Um, but I mean,
Just mostly those two,
I,
psychiatrist and medication, mostly the biggest thing for you this year.
yeah, pretty much. Like I said, it's been more than a struggle to find anybody to even write a prescription to extend my scripts or really anything to listen. It's been very, very difficult. And frankly, I'd say that's been one of the biggest hardships of all this, going through all the things that I've been through, whether it be where I'm living or financially or with friends, it would have been very, very nice to be able to sit with a therapist or a psychiatrist, to be able to get some of that information out and be able to open up.
Right, definitely, definitely. I agree.
Everybody needs to get a little bit out, right?
I think it's nice that, oftentimes, even though we have friends and family in our corner, sometimes it's nice to have, a therapist, a psychiatrist, someone who's more neutral in that aspect, to have somebody in your corner to talk to, someone that may
Yeah.
understand what they're kind of going through. So I think that's definitely very important to talk about. Okay, how would you encourage a friend or family member who is struggling right now and is unsure of where to get help?
Well, what I would say is do you. Um, it took me a long time to figure out what exactly was wrong with me, but if you do the right thing, you do this, the right steps, you get your psychiatrist, you get your therapist, you get medication management, you get to talk to someone, you get it out, it's the best thing for you. And truly, it's been one of the greatest gifts that I've been given. Um, you know, and it gets better for sure. It doesn't have your mental health and your diagnoses aren't you as a person. You can always change it.
Good. I think that's really nice to hear from somebody, especially as a man. Oftentimes, therapy is very looked down upon, and so I think it's really important to hear how important therapy is, how important medication is. Medication not always necessary, but I think having a therapist, having somebody there to talk to, can really make a world difference. I think personally. So I think hearing that from me specifically is really helpful for not just yourself, but other clients and friends as well. So.
Absolutely. There's a lot of you know I grew up in a household where showing emotion and stuff like that was kind of, guys don't really do that. But, if there's anything I know and I've learned, and shedding certain past, shedding that from yourself, learning that you can cry, learning that you can go talk to a therapist, learning that you can go talk to a doctor. And, that's their job. They're there to listen to you. They're there to help you. You don't ever have to be ashamed of, talking to anybody, it's better to talk than not to talk.
Right, definitely. Okay, so we're gonna wrap up. Do you have any last remarks that you want to share? For other clients, other peers, friends, family, any other remarks you want to share?
Absolutely. To my family, stay strong. I love you guys, and I believe in you all. We all have our struggles, and we're getting through them. To anybody going through anything, it gets better. It really does. I've been in some really, really dark places, but I can absolutely, without a doubt, say, you apply yourself and you do the right thing, things will absolutely get better. Don't give up.
Thank you so much for participating. I really appreciate it. So we can go ahead and stop this.